Significantly cut down the number of complications in surgery. And for patients, it's all thanks to a new tracking device, which researchers describe as something of a black box like the ones that are placed in airplanes, and that records surgeons' movements and is also supposed to help identify errors during an operation. Dr. Samadi, what's this all about?
Well, this is supposed to be very similar to exactly what goes on in the black box of the plane. So it's the study from Toronto. The Canadians are putting in microphone in the operating room. They're putting multiple cameras all over the operating room, and they're taping the entire process. Interaction of the surgeon with the staff, what goes on in the operating room, how you handle the organ, how you do your stitches. And the reason for this is to reduce the number of complications, to make the surgeries flawless, but also more important, use these videos to educate our next generation of surgeons. You never asked me, Eric, how I learned robotic surgery. Do you go in the operating room and learn, or do you practice outside and you operate in the operating room? I think when we grew up as doctors, there was a concept of see one, do one, teach one, meaning that you look at one operation, then you start doing it, and then you become a professor and you teach it. That time has come and gone. And the way we do this, I think this is a good program. I think the idea of having black box is to go back and find out what mistakes you learned, and it's exactly the way professional athletes do this. They look at their games, they tape the game, they go back and see, how did we lose the Super Bowl? How do we become better? So that's what this is about. There are some issues with this. It's an early part of the study. And one of the things I've done in my operating room in order to cut down the efficiency is that we already did this 10 years ago. I used to tape all my surgeries and watch. That's how we came up with this smart technique for prostate cancer, and that has been efficient. So you don't want to practice. You want to come in and do the operation. We have simulators, and that's how, by the way, Mark is going to talk about this. The pilots are not going to learn how to fly the plane right where they have the passengers. You have the simulators, so you take the MRI of the kidney or MRI of a prostate, give it to the computer, you practice outside the operating room, so when you come on Monday morning, you're efficient, you do the surgery, and I think it's a good idea.
What about the legal issue?
Okay, so that's the other side of the coin. We're calling this "let's go to the videotape." You know, is it a foul ball or is it a fair ball? And the studies coming from Canada are showing, and they use the laparoscope for this, which is not exactly what David does with a robot, but they attach the camera to the laparoscope, and then they had another camera looking down, the view from above. And they found about 20 mistakes per operation that were missed otherwise. So if you use this for peer review, Laura, you could teach residents, as David was saying, you could teach other doctors. The Healthcare Quality Improvement Act in the United States forbids that kind of information being used legally, to answer your question. So if it's for peer review, it can't be used legally. But lawyers are going to say, well, wait a minute, if there's a major error made, why shouldn't I have access to that? And I bet if we ask America's patients out there, they want to know what goes wrong, if something goes wrong. So this is a very debatable issue. I agree, though, that the number one purpose of this is teaching to learn from mistakes. And by the way, somebody who comes out post-op, you may not know why something goes wrong. If you can go back, there's something called arachnoiditis, where somebody accidentally punctures the lining of the spine and you get some nerve problems. If we could go back to the operation, we could see exactly where that happens. So there's a great advantage in terms of learning.
Well, whenever we have, for example, the M&M, we call it morbidity and mortality, all the doctors in the department get together and look at exactly why one complication happened. So all the professors are discussing this. And that now, if you have the video of that surgery, you can look and see, look, this is exactly what happened. And for learning purposes, improving our surgical skills, this is a good way to go. And robotic surgery and laparoscopic basically is the same kind of pathway. So this has been tremendous in educating our residents, our future doctors, and it works well.
All right, whatever helps.